Hello, and welcome to our fourth edition of our Dry Eye Education video series. My name is Dr. Jason Miller, and today we're going to talk about patient communication and education. This is Melanie. We found out that she has potential ocular surface disease at her initial contact lens evaluation. She has returned for a dry eye workup, and we are here today to discuss her care and her ongoing management. Let's go see. Melanie, now that we've completed your exam, I can definitely say your symptoms are due to dry eyes. This is a common ocular surface condition. This may seem confusing because your eyes are actually tearing, but it's common for eyes to water when they're dry. That is called reflex tearing, and it happens because they're dry. I've been seeing more and more patients in the last few years with dry eyes because of many reasons: a history of LASIK, the use of medications like antihistamines, or even just because of the dry environment we work in, or the increased use of digital devices. The key to treating dry eyes is to identify the stage of the condition and actively addressing this disease.
That sounds bad. What does that mean?
Well, let's take a look at these images I took when conducting all the tests on you first. Fluorescein staining shows damaged or irritated cells on your ocular surface, a condition called corneal punctate keratitis. This is key to identifying how severe your dry eyes are. Lissamine green staining along the inside of your eyelids indicates lid wiper epitheliopathy. This is kind of like trying to clean off the front of your car window with worn down windshield wipers. These diagnostic tests and a few others today help determine that your dry eye condition is in the mild to moderate stage.
Is it treatable?
Very treatable. And while your condition is chronic in nature, which means it won't go away, so treatment is critical to the long-term prognosis. Although your symptoms vary throughout the day, this ocular surface condition makes your routine daily tasks that much more difficult. It's a frustrating condition, and it can hinder your vision throughout the day and even nighttime driving. The good news is that we're able to diagnose it early on. I'm going to prescribe some anti-inflammatory and cyclosporin eye drops to add on to the over-the-counter drops you already have. This will help reduce the inflammation in your eyes and help you produce better tears on your own.
Now, will this work forever, or do I need to make follow-up visits?
Well, it does take some time to see improvement with this condition. And since you're in the mild to moderate zone, we will need to schedule a follow-up visit in about 6 to 8 weeks to determine how well you're responding to the treatment. We can schedule further appointments after assessing the severity of your condition at that first follow-up visit. I also have some educational materials for you to review later on, and you may find these very helpful.
Thank you, Dr. Miller, for explaining everything about my condition. It was helpful.
You're very welcome, Melanie. Bear in mind, if left untreated, ocular surface disease is a progressive, potentially irreversible condition. The cycle of inflammation can cause permanent damage to the ocular surface. Therefore, having an in-depth conversation with your patients about their dry eye condition is vital. You have to assume that your patients will require some sort of hand-holding during that initial phase of the treatment plan. So you play a critical role in improving the compliance with their treatment. Thank you for joining us for this dry eye segment. Join us next time when we discuss billing and coding for dry eyes.